All right, I will be talking about this content based on my own personal experience, you know, having been a healthcare assistant for quite some time. Now, why do most people, especially dependents, why do a lot of people, even graduates, go into healthcare assistant jobs? Well, I am a UK graduate. Yes, I had my degree here in the UK and I graduated with a better grade. So I'm going to be honest and simple, answering this question. Why the choice of, me working as a healthcare assistant, and this will also extend to, the reasons a lot of people chose to be healthcare assistants or chose to work as healthcare assistants here in the UK, especially those who probably have been professionals, who have worked, who have done white collar job in their countries back home, who have degrees or even some have masters, and yet they move to UK and take up this very job of a healthcare assistant. Though basically healthcare assistant job has been recently added to the UK shortage occupation list, and that makes it a skilled work, just like every other profession that is skilled work, it is not included in the skilled workers job list. Meanwhile, it is also a job that requires little or no education for you to take up, someone who has just secondary education, high school education, sixth form education can just do a couple of trainings, like the care training, care certificate training, and then take up this job. You can even start up this job without experience and you get trained while on the job. So why do a lot of people, a lot of graduates, especially of international background, why do they come into the UK and take up this very role instead of going into something more professional, something more, should I say, skilled? I will be answering this question based on my own personal experiences. I am a graduate, like I stated earlier. Why did I choose to do a healthcare assistant job? I will also be talking to you about the salary, the pay rate of a healthcare assistant, and the working schedules, because this is one of the major reasons why a lot of people choose to go into healthcare assistant. First, healthcare assistant job is a job that is readily available to everyone coming into the UK, and there are a lot of job vacancies open to everyone. They can take you to work in this very field. Hence, you are interested, you have the willingness, you have shown that you have emotions, you have that empathy to care for people, to provide personal care, emotional support to people in need of it. If you meet these requirements, definitely you are good to go on this job. And there are a lot of them. There are different kind of job roles for carers, which is not what I am going to be stating in this very video. Why do I choose to be one? Now, I have a husband, yes, whom I am dependent on his visa. He is employed here on a tier 2 workers visa, just like a lot of people came into this country. If your spouse is a skilled worker, sometimes it's a bit difficult for the other person to work a full-time job, because as it stands for myself, I cannot take up a night shift, full-time night shift, which is something that should have been good for me, because if I should apply for a full-time night shift, I should be working about 3 to 4 times in a week. But it wouldn't work in my case because my spouse also works nights, which he does for about one of the weeks in the month, so it is something difficult for someone like me to do. And I cannot take a full-time day shift. Yes, because right now my spouse left for job today. He resumed work at 10 a.m., finishing 7 p.m. So when is the time for me to go? Especially if I have a full-time job, I can't just, it is something very complicating for a lot of people. This is the reason. The working schedule, the shifting schedule is something that make a lot of people to go into healthcare assistant, because You could take up a healthcare assistant job as a part-timer. Probably when I was working in my last job, I just work only 2 times a week. In that 2 times a week, I cover 21 hours. And sometimes I do more than 21 hours a week. Why? Because whenever my husband is off and the shift comes up at my workplace, if they call me, if I am disposed for it, I go for it. I don't work nights. I did not ever, apply for night shift in my workplace. But when they call me and I know that Mr. is home, I go for that extra shift. If you are doing a permanent work, nobody will call you for an emergency thing, shift like that. So the shifting schedule is the reason why a lot of people go into it. In some care homes, shift starts like where I worked. The morning shift starts 7:30 in the morning until 2:30 p.m. and afternoon starts 2 p.m. to 9 p.m. In the hospital, some people work 7:30 in the morning until 7:30 or 7 in the morning until 8 o'clock. I have had to work in the hospital in the past. I've resumed work 12 o'clock, finished by 6 o'clock. And in certain homes, I have had to work 4 to 10 p.m. So they give you that time, depending on when you can interchange with your spouse or with your husband, especially if you have children. If you don't have children, you have freedom. You can go and pack up, at your workplace. But remember that it is also important to give your body a rest, So this is one of the reasons. And how about the pay? The pay is something not bad because in NHS, especially hospitals, healthcare assistant and for instance, from 18,000 to 24,000, you can make more than that, especially when you start taking up extra shifts. In care homes, about 23,000 from 18 to 23,000 per year, but a lot of people earn more, especially when you do extra shift. So it is a kind of shift that enable parents, people with children, to interchange, do something first. And it is a readily available work for you to take up on arrival in this country so that you can start earning money to sustain a living while looking for whatever job you are looking for. Every job is now professionalized. Yes, even a cleaning job, if you do not do it well, your client might sue you. So healthcare assistant job role is also a professional job, just like it has been added to skilled workers job. I have a colleague, we do school run together. The husband work, I think five days a week, Monday to Friday. He starts work, I think 7 a.m. in the morning, he starts work 8 a.m. in the morning and finishes 4 p.m. But this lady, in fact, she has a full-time job as a carer in a care home close to our house here. So what she does, I think she works 3 to 4 times in a week, depending. She also does alternate weekend, like this very weekend she's off, But then we do school run together. Last night she worked. Her work starts 7 p.m. and by then the husband is home. So she finishes 7 a.m. in the morning. Remember here, primary school, they start 8:45 a.m. So once she comes home, she gets her boy ready for school. If I will walk down to school together, drop the boys in the school, her boy and my own boy, then we'll come back home at 9 o'clock. She goes to sleep. Waking up again at 2:30 because school closes at 5 minutes past 3. So as from 2:30 to 2:40, we're already strolling down, especially the day we have to work. If we have to catch the bus, it's 2:35. So everything here is programmed, is really designed in a way that everyone is given an opportunity to work. And if you are doing a cleaning job, I bet you can have a cleaning job you can do for 2 hours in a day, 1 hour in a day, 3 hours in a day. So they created this opportunity. They make sure that everybody is gainfully employed. You don't have any reasons to say you do not have money. People who are underaged, people who are less than 18, especially students in high school, there are certain minimum of hours or maximum of hours they can work. If you want to be useless, this country can help you. And if you want to be useful, everything is available for you to be responsible and useful in this very country. Yes, honestly, I would be happy to have my boy working ever before he turns 16. Even if it is 2 hours he goes to work, 3 hours he goes to work, it is something. He earns a little and knows, yeah, this is how to earn money. Do you remember that Obama's kids, they were working in McDonald's, a restaurant, the president of the United States of America? And this is great. Michelle Obama also mentioned that one of the times that she has to ask the daughters to do the cleaning and arrange the house, you know, when they have people employed to do all this work. So in this country, you can always have something doing, unless if you see those walking on the street, they choose to be honest, unless you do not want. And if you keep saying, I have a degree, I am a graduate, I am this, therefore I am not taking up any job, you are waiting for the so-called white-collar job. You know, I know bankers whom healthcare assistants, they earn more than them, to be honest. Some bankers earn £11 something per hour, some earn £12. And healthcare assistant, if you work on Saturdays nights, honestly, you are earning £13 something, £14. And if you work on Sunday, that is double pay. You are earning about £18 something or thereabout. Bank holidays times 2, you know, but this does not happen with some professional jobs, you know, so you do not have any reason. These are just some of the reasons a lot of people, you know, take up this job, and a lot of people go into part-time job. A lot of people choose to do this healthcare job or menial jobs that will sustain them and their family, or that they will be supporting their spouse who is also doing the full-time job while this other one is doing part-time job. So this is basically how it works, and this is the reason why a lot of people choose healthcare assistant job for a start. And it does not only end there. From being a healthcare assistant, you can also progress in your career. You can also develop interest to becoming a nurse, to becoming a professional in any medical field, you know. And it's a whole lot of starting points. You know, it's like an internship, you trying to see if you can actually do this or that. I remember those days, one of my friends, you know, she is currently a nurse, but she was working as a cleaner in the healthcare home where I was doing my healthcare assistant job. Then she comes in to do her cleaning job. To be honest, after a while, she got a healthcare assistant job, but now she's now a UK trained nurse, certified. You see how it goes. So it's a starting point. It's a ladder for you to progress to some other careers. All right, thank you so much for watching this content. Subscribe to my channel if you haven't, and keep coming for more. Bye.